couple of different points on access. One is, I think, we have to make sure that we have enough resources in the community. In our community, I think what we found is one of our problems is we don't have enough resources. If we need more safety net providers for the uninsured, or either we need to find a way to insure the uninsured, because right now they have nowhere to go. So that's issue number one, is we need to get enough primary care in this community, whether it's through Regenesis, the community health center, or whether it's through the free medical clinics, or whether it's through the residency program clinics at the hospital, the rural health clinics. We've got to have more in this community. But another thing that I think, and this is just kind of a little different twist on access to good care, is around funding healthcare technology. Part of the issue of providing good care for people is understanding what the needs are. And so I'll just give you an example. We, for the past couple of years at Spartanburg Regional, have been investing in putting electronic medical records in the physician offices. And so we have enough for almost all the physician practices, I think, are on EMR, electronic medical record now. And so we've started doing studies and pulling data out of the system, and it's been amazing. The first example was we looked at a year ago how many diabetic patients do we have in our entire physician network. We found that we had 7,000 diabetics in our system. And at that time, we checked to see how many had blood glucose levels that were out of control, greater than 9. We found 20% of our patient population in our electronic medical system had blood glucose levels that were out of control. We shared that information with the physicians in the medical community, and then we followed up a year later, this past year, to look at now what is the issue. 1 year later, that incidence of out of control levels has dropped 50%. Now only 10% of our patients have blood glucose levels out of control. That's what healthcare technology can do. I mean, when you talk about changing the system, technology is amazing, because we can't change things if we can't understand what the issue is, and we can't understand the issue if we can't measure it, and you just can't measure it as long as we're on paper records. I think healthcare technology is going to have a huge impact also in helping us coordinate care. I think one of the problems we see in dealing with chronic disease is that patients bounce from provider to provider, and we don't know what each other's doing. And so we waste dollars because we do unnecessary tests that somebody else has already done. We may have an incomplete picture on Congressman Inglis's dad because he doesn't tell us what's going on, and so that physician only sees this much of the information. Yet if we had medical record systems that were talking to each other, that physician would have more accurate information with which to treat that patient. So I think investing in healthcare information technology is going to be huge for us. We also, and this is related to preventive care in chronic diseases, we pulled out of our system to see how many people over the age of 50 had had a colonoscopy. If you're over the age of 50, you should have a colonoscopy, and so we checked and pulled out of our system. We then took that information and we sent letters to those patients, and we said, according to our system, you need to have a colonoscopy because detecting cancer early is critical to treating it. Out of that, we had 9% of the people that we sent letters to who chose to have colonoscopies. So that's 9% increase in the number of people who had that screening test. And then we had another 10% of the people that we sent letters to who actually had a colonoscopy, but it wasn't in our medical record system. So that's another, I think, plus for us, because again, if that physician is going to be able to treat that patient, he's got to know what's going on with you. So we've got to figure out a way to get technology, to fund it, and then to use it to help take care of patients.